I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello, welcome to another episode of Boomer Health at Home, the show where we provide you useful information to keep you and your loved ones happy and healthy. I'm Ryan Donnell, your host, alongside Brett Pulte, and joining us today is a very special guest, no stranger to Bloomfield Public Television, is Dr. T. We used to have your show Ask Dr. T, I'm sure we're all
true.
Yes.
Yes.
We are here today to talk about a term we've heard kind of passed around with involving IV treatments. It's called infusion therapy, and
Sure.
we've heard of this being done in homes and in clinics and all that. We're hoping you could shed a little more light on what is this new, or maybe not new, but term that's kind of floating around. So,
Yeah. Sure. So, you know, IV therapy, infusion therapy, there's a lot of clinics and offices that are performing this now. We started doing this probably about 8 or 9 years ago.
Okay.
And it all started originally, we started doing this because we had a lot of patients that had quote unquote fibromyalgia, chronic fatigue, and there were studies that showed that IV treatments of different nutrients, for example, magnesium, B vitamins, vitamin C, would help with the symptoms that patients had that had chronic fatigue syndrome and fibromyalgia. So that's how we originally got started. Then we found that there were a lot of different applications for different conditions. For example, we do a lot of IV vitamin C treatments because for cancer patients, in conjunction with their chemotherapy, because there are studies out there that shows that patients do better as far as they have less side effects from their chemotherapy when they have IV vitamin C treatments done at the same time. So, and what's nice about it too is that the oncologists, hematologists out there are, you know, initially it was like, oh no, we can't do anything like that. It's just got to be pure chemotherapy and our treatment. But they're realizing now that no, patients are doing better. There's no negative effects with doing these IV treatments, and it actually shows that it improves the outcome with the patients. It actually helps the chemotherapy work, which is, so that's another example of the type of IVs that we do. We also do chelation treatments, which is basically you're pulling heavy metals out of a patient, or you're trying to improve the circulation of a patient. We do different detoxification IVs. There's a whole slew of different things that we can do.
Well, that's
as a starter.
Yeah.
That's the first question.
Yeah, that's good.
Yeah. No, that's extremely interesting. So, what goes into an infusion therapy?
So we have an infusion suite where we have these lazy boy chairs. You come in, you might be a little apprehensive at first because obviously it's an IV, you're going to get poked, but you know, an IV is started on you, and then depending on your condition, you're getting an infusion that's going to last anywhere from an hour to maybe 2 hours. For example, I just thought of, you know, we get patients that they have low iron, and they either have this because well, there's a number of reasons why they might have low iron, and just taking an iron supplement or prescription is not helping. So they'll come in and they'll get an intravenous dose of iron, which works really good. You know, helps with their energy levels and their symptoms they're having from being anemic.
So is it just work better because it's straight into the bloodstream and not? I mean, why does IV work quicker?
So here's the thing, and there's a lot of people out there that they're not absorbing their nutrients. They have malabsorption, and it's because it's something that happens to us innately as we get older. We stop making stomach acid. We stop making digestive enzymes, and so we're just not able to absorb as well as we used to. So for those of you at home, if you're wondering if you are someone like this, there's some telltale signs that you can look for. For example, if you have vertical ridges on your nails and it's like, oh, I never had those before, why do I have those? That's a sign that you're not absorbing nutrients, okay? If you look at your tongue and it's got a white coating on it, or if you've got like crevices in it, if you will, cracks, or if you've got a line in the center of your tongue, okay, these are all mild signs that you may have malabsorption, or you're not absorbing well. The other thing is, if you look at your medication list, and if one of those is like Prilosec or omeprazole, one of those medications for GERD, hey, you're not absorbing, because basically what that medication is doing is it's stopping you from making stomach acid. And if you don't have stomach acid, you don't absorb minerals, B vitamins, amino acids, proteins. Okay, that's why in those commercials they have on TV, they say, may cause low magnesium and osteoporosis, because you're not absorbing calcium. So, and those medications, by the way, they're only made to be on for a couple weeks to a month. They weren't made to be on long term. Yeah. I'm going off a little bit to a tangent there.
It's good.
So there's a lot, again, so then there's a lot of people out there, they're just not absorbing their nutrients, and when you do it intravenously, it's getting in your system, period, okay? And you're able to get a higher concentration at any given moment, okay? So what that does is it goes to the different cells in your body at a higher concentration. So it has a different physiological effect because you're able to do that. It's impossible to do the same thing by taking it by mouth. For example, vitamin C. We use really high dose vitamin C, anywhere from 50 grams to 100 grams, which is 50,000 milligrams to 100,000 milligrams. Well, no one can take that much vitamin C. What happens is it just shoots right through you. You don't even want to try to take that much.
Yeah.
Okay. So, as an example, and there's other examples like that too.
Yeah, they say the American sewer system's filled with like all sorts of supplements and all that from all the.
Right. So here's the other thing about that too. So like they say, you've got, I've got the most expensive urine in the world. It's like why? Or some people will say, well, why are you even taking that? You're just peeing it all out anyways. It's like you're wasting your money. So if someone says that to me, I ask them, do you drink water? And it's like, well, what are you talking about? Yeah, of course I drink water. Well, why do you drink water? You're just peeing it all out anyways. Well, no, I'm not. my body keeps what I need and the rest goes out. Oh, your body keeps what you need.
Yeah.
Well, same thing with vitamins and minerals.
Interesting.
So.
Yeah. So now, are these treatments meant to be like long-term, continually having to come in for them, or can they also be kind of a one-time thing?
Usually they're not long term, and sometimes it's a one-time thing. But usually a patient will come in for anywhere from 3 to 6 treatments, maybe a couple times a week or longer. For the example of a cancer patient, depending on how long their treatment is, they'll come in and have their IV treatments during that period of time. And then there's other patients, they come in periodically. So let's say it's an athlete, and it's an older athlete. They're not a professional athlete. They're amateur. And they run they run marathons, or they're a cyclist. And they had a big event, or they do an Ironman, triathlon, something like that. So they'll come in and they'll do treatments before, to get themselves, I don't want to say pumped up, but nutrient up, to the point where they're doing the best they can, and then afterwards they're coming in to help recuperation. And so depending on how often someone's doing something like that, they might come in maybe once a year, once every 6 months to do something like that too. Depends on the situation.
Yeah.
So
So is IV, of course, the first thought is IV has to be done in a hospital or a clinic. Can they do these at home too? Or?
Oh, yes, they can be done at home. Unfortunately, right now we're not doing them at home, but we're working on that. Huh. We would like to be able to have a situation where a patient doesn't necessarily have to come into the office to have an IV. We get patients that come in from 2-3 hours away. They live, upper Michigan, and they'll come down to Bloomfield to have their IVs done. And it's difficult. It's hard to do. Sometimes they'll stay in town for a couple days, luckily because they have relatives. Or they'll come down, they'll drive down, they'll stay in a hotel, and they'll go back the next day. But we're working on being able to have a situation where we can do it, go to their home and do the IV treatments.
Wow. That's interesting that, being able to travel with it in some instances. So is this an option for all patients, or are there certain requirements that someone has to meet to be able to have an infusion therapy?
Well, you got to be breathing. That's a good one.
That's a good one.
That's important.
Number one.
No, it's for all people. Yeah, it's available to all people.
That's because, like you said, especially with the athlete, they'll come in before and after, and generally everyone's thinking, okay, an athlete's healthy, but then you also say you help cancer patients. So.
Yeah, but athletes are healthy, but they're working harder, than your average person out there too. They have nutrient needs or vitamin needs that maybe your average person doesn't necessarily need, because they're sweating. When you're sweating, you're losing a lot of minerals. Okay, you're detoxifying too, but there's things that you need to replete, things that you have to take. Any athlete out there knows that if they've been, doing a lot of sweating or working out a lot, they might get like a muscle cramps, that just doesn't go away. Well, that's because they've depleted themselves of magnesium or potassium. And those things can also be put into an IV and repleted at a faster level.
Interesting. Now this question, actually, Brett and I write questions. This is one of yours, and it's a good one, but I'm going to steal it because I like it.
Okay.
We talk about the infusion therapy and all this as an alternative to other treatments. Are there times where that's the only option? Is this infusion therapy and stuff of that nature?
Oh, I would say yes. In some cases, that might be the best option. So, for example, I'm thinking of things that are a little bit unique. Like, let's say you get a pregnant female that's in her first trimester, and she has quote-unquote hyperemesis gravidarum, where she can't hold anything down, and then if she goes to the emergency room, what do? They give her IV treatments, because that's the only thing that's really going to help them, is to rehydrate them. Well, there's people out there that are like that. You've got, say, cancer patients that are having trouble taking things, by mouth. You've got other patients that may have a feeding tube, where doing it intravenously is the only way you can do things. But then also, again, what we were talking about before is let's say, we're doing like Myers cocktail again, where it has certain nutrients. Yeah. That might be, quote unquote, the only way to do it, because that's the only way it's really getting absorbed and into the patient. Because of some other medication that they're on, or because that they're not making enough stomach acid or digestive enzymes. So in a lot of cases, and it just depends individually on the person.
And like you've been saying throughout, everything we've done today, it's all person by person.
Right.
So is there anything that an average person would normally come in for?
So an average person usually our most popular is the vitamin and nutrient IV, which is, again, they call that the Myers cocktail, because it's just sort of, it's like a generalized, well-known IV that helps a lot of different things. It's good for energy. It's good for, a lot of people, they're working pretty hard out there. They're working 60, 70 hours a week, and maybe they're playing hard, and after a while they just get exhausted. So it's a very popular IV for patients just need a little get up and go. Unfortunately, it's also a really good IV, like for for Monday morning, for when, like if you've had a really hard weekend, okay?
Coming home from a bachelor party or
right,
something.
Right. You've been partying all weekend and you're like wiped out, and then, like, patients will come in, Monday morning because we're not open on the weekends.
Yeah.
That's Tuesday, Wednesday, Thursday, Friday, Saturday. For
Yeah.
them too. This would be a daily occurrence for you.
Yeah. Thanks.
Ooh, have you been in? I don't think I've seen you. I don't think I've seen you back there.
I probably should step in.
Yeah.
So actually something else I just thought of too, not because we're talking about you.
Yeah.
It's also a treatment for withdrawal. Okay, so whether it's any type of medication withdrawal, they've got studies that show that different IV therapies can help decrease the symptoms. Okay, so.
That's interesting. I mean, the withdrawal symptoms, like you mentioned, people with like GERD and acid reflux, and
Sure.
like family members take it, like they'll take Zantac just religiously, and
Sure.
it's like, do you need it? I think when they take it and they're off it, maybe they'll experience some heartburn. They almost go through like a mild withdrawal.
Sure.
It could be that nutrients, all that. It could be if they want to get off that stuff. That's what I was thinking when you were saying that. That's interesting.
Oh no, yeah, and I try to get patients off that. That's like, you wouldn't think that, but when I see that those type of medications, that's like I tell patients this is probably one of the worst things you're taking.
Yeah.
Just because of what it's doing.
I always laugh at the commercials because they got, it was Larry the Cable Guy does
Yeah.
Oh, yeah.
He's at this barbecue eating, greasy burgers, like obviously junk food. It's like, I can eat whatever I want. It treats my heartburn. It's like, maybe don't eat that. You won't have the heartburn. It seems like, there's a little disconnection there. But
That's true.
That's good. Well, that's very interesting. I think there's a lot of new things on the market. Like you said, you've been doing it 10 years, but it always seems like Michigan is like West Coast sees it, and then we find it 10 years later. It seems like a lot of that. So I'm happy to hear there's new alternatives out there, and it's a pleasure to have you on the show to speak about
thanks.
it. So
Glad to be here.
Any closing remarks, or you look like you're about to say something? So.
Yeah, as you said earlier, one final question.
Sure.
As you said earlier, with a pregnant woman, she may not be able to keep things down. My wife and I are actually expecting, so my wife is experiencing a little bit of that, but not that much. How often would it be an issue with a woman not being able to hold something down while pregnant that they would need to come see you?
Oh, so it's all individualized too. It just depends on the person. It's hard to answer that question.
Yeah.
But with that condition, usually the faster you treat it, the faster it goes away. Like if a lot of times, like a woman will be like, oh, I'm okay, I don't want to go to the hospital, because who wants to go to the hospital?
Yeah.
And so you wait a little bit too long, and then it just sort of, it makes it harder for you to come around faster. So I guess I would recommend for anyone out there that is does experience that in the future, that the faster that they go for treatment, the faster it'll get better, and better of a chance of it not coming back.
That's good. It's good advice.
Yeah.
So if anyone is maybe looking to schedule an appointment with you, where can they reach you?
They can call us at 248-302-0473, or they can go to our website. It's askdrT.weebly.com, or you can email me at drthelpdesk@gmail.com.
Very good. And also, if you have any questions, comments, short stories, or anything for our show, you can email us at boomerhealth@americaremedical.com. I want to thank you for tuning in, and we hope you have a great day.